We continue with placing the artificial teeth on the lateral aspect of the upper jaw, the maxillary. So this is the artificial teeth. Second premolar and first molar on one side. On the second quadrant is the two molars that we need to place. So I marked the middle of the crest on the pattern, the wax pattern, and also where I think the sulcuses of the two teeth will have to be placed, aesthetically, obviously. So I start on the first quadrant. This is optional, obviously. I start with the second premolar. The height is bigger than the tooth here, the height that I need, so I add a little bit of wax. The second upper premolar is placed on the middle of the crest, always. It touches the occlusal plane with both cusps. And the cervical region goes a little bit mesial in relationship to the occlusal plane. So it goes a little bit towards the distal as you look at it from the lateral. Once the position is established, I glue it with wax, so to say. I fix it to the pattern, filling the space. I take care not to deep it, actually, not to sink it, adding too much wax. Of course, this will be retouched later, but I don't want to work too much afterwards. And now I'm going to place the first molar. The first upper molar is also to be placed on the middle of the crest. Its axis is a little bit mesial oriented if you look from the occlusal plane to the cervical region. The marginal crests of every tooth are at the same level. This is a very good orientation detail. You see, the incisal margins also, they should be continuous, like continuous curve, which is the curve of the arch, actually. The occlusal plane is touched only by the mesiopalatal cusp, and together with the lower molar form the angle key. Now it's okay into position, so I can fix it with wax, filling the gaps and actually fixing the tooth in position once I'm sure I placed it correctly. You see that wax is added piece by piece. I don't want to add more than I need. this side has to be even, non-retentive, so that the tongue will not be disturbed. So we continue now on the labial. We fix it for good. Here also we have to do a flat modeling of the pattern, because the physiognomic, the aesthetic aspect is not important here anymore. It's just function that counts here. So we want to avoid any food from being retained there. I close also on the interdental region, mimicking the papilla, and then I allow the wax to dry, actually to cool down. And I continue in the second quadrant. That's the first molar. The teeth were adapted, right? So shortened from the gingival, the mucosal aspect. The same principle that we have presented last time in the previous video. And we have to take care to place the teeth a little bit towards the outside, yes, to respect correctly the buccal corridor, as we call it, the black aspect on both left and right when the patient smiles. So, as we said, the only cusp that touches the occlusal plane in this case is the mesiopalatal cusp. This is quite a simple case, what we're doing here. We have much more complicated and difficult situations in real life. There's no antagonist in this case, so we just place the teeth according to the rules, according to an imaginary plan. So that's why it's that easy. So again, the tooth faces a little bit to the distal, the occlusal surface faces a little bit to the distal. That means that the cervical region goes a little bit to the mesial when you look from the lateral side. Now we close the cervical region on the labial, adding wax. And again, the modeling should be smooth, non-retentive, no undercuts. So also on the interdental space we want to close to make sure that the tooth is well held in place. And now we can add the second molar. We want the arch to be symmetrical, forces to be correctly distributed. So for symmetry we continued on the distal of the 1-7, okay, just to make it symmetric with what we have on the other side. So equal number of teeth, symmetrical design of the wax pattern, of the wax frame. So the second molar goes even more towards the distal, yeah, or you may say the cervical part goes to the mesial when you look from the lateral side, lateral aspect. That means the occlusal surface goes a little bit outside and distally, right? Actually, it's the two plans, the Wilson and the Spee, the von Spee plan curve. It doesn't touch the occlusal plan at all. The closest to the occlusal plan is the mesiopalatal cusp, which is like 0.5 millimeter from the occlusal plan. The occlusal plan actually is the table, as you would put the model on the table. That's the idea. So I cut a little bit of wax because I wanted to go a little bit faster there. I place it on the distal of the last molar. I want to have a very solid fixing there. And I want this region to be non-retentive, no undercuts, and again very smooth in order to avoid food deposits while chewing. The oral aspect, palatal, in this case, so everything has to be smooth again. So we close at the level of the papilla. Again, no undercuts. Now we come back to the first quadrant. The wax has cooled down already. So now we do the modeling of the cervical region, the gum level, the papilla. I move quite fast, but you may see that I go in only one direction. I want everything to be as thin and soft as possible at that level. I get rid of wax residues if they stick to my instrument. The wax doesn't have to be bulky, just strong enough to sustain the masticatory forces. I blow a little bit of hot air on it just to make it very smooth and nice. If needed, I continue the modeling. But again, it's not an aesthetic zone. It has to be functional and non-retentive. So now we come to the second quadrant. It's a very simple modeling, nothing complicated. Then we remove the excess wax. I don't want it to be bulky, to have excess wax. No way. It has to be as small as possible, just the needed amount just in order to ensure the distribution of forces, not more. And again, it has to be smooth. I clean the teeth at that level thoroughly to remove every wax from the labial surface of the artificial teeth. A little bit on the labial, I want to make it smoother. Again, the instrument goes in only one direction when trimming the excess of wax. Now the toothbrush did the job. So I put a little bit of hot air with a little pump, mechanical pump, so that hot air goes from the flame onto the surface of the wax. And yeah, small retouches that need to be done. Maybe I have to add a little bit here. It's a little bit concave. I don't want that, because this would be a possible place for food deposits. I want to add as little as possible, because otherwise the tongue will not have space anymore. Yeah. This is the main problem with dentures, that patients feel a huge discomfort when they receive them. Afterwards, they get so much used to them that they can't even sleep without them. But at the beginning, it's not easy. And this is the pattern, and it's ready to go to the office, to the dentist, to see the aspect in the mouth of the patient. And then we will produce the final denture.